So just to begin off with the general situation that we have for today, the numbers that we have recorded for today, and we'll have an English language slide coming up for you soon. So we have for you today new confirmed cases recorded at 959 cases. Now, when I mention this, don't be too alarmed, because 959 cases, the majority of this today is from active case finding. And as I mentioned before, the more cases that we are able to find through our active case finding missions, the safer, the more contained it will be. So out of 959 cases that we have for today, we have 848 of those cases from active case finding, and the rest from outside active case finding. The new recoveries for today, we have recorded 230 new recoveries. So making the cumulative number of cases so far since last year over 14,000 and recoveries over 10,000. We have the same number of fatalities, fortunately, 75. And the active cases, the cases that are currently under treatment right now, stands at 3,679, as you can see on the screen. Now, it's January, end of January right now, and as I mentioned yesterday and the days before, we're looking towards the end of January as the cutoff date that we will be able to become more flexible and release more relaxed measures, relaxing our measures as appropriate. So, just some observations from the briefing that Dr. Tui Sin had mentioned just now. Firstly is, of course, that it's been 10 months now since we had announced the emergency decree, which was in the beginning, around in March or April of last year. And with this, we've been able to control and contain and the officials involved have been able to perform their duty to the most effective way and manner. And this is why that our numbers are not as high as in other countries. Dr. Tuisin just now showed some charts comparing different countries in terms of the highest number of infections, in terms of the spread and everything. So Thailand did not make that top 10 list, so to speak, top 10 or top 20, because we still remain at 120 plus ranking. So of course this comes with a lot of dedication and sacrifice, and the decree, the facilitation that we offer to the officials is for this very purpose. So some observations, starting first, that globally, this is also a number that we've reached globally. The world has surpassed 100 million already since last night, the 25th of January. Over 100 million cases recorded globally. And this is the 391st day after the first case was reported. Within Thailand, the overall situation remains stable. The increase in the new confirmed cases today is due to the accelerated active case finding. And you perhaps saw that in the press already. We're accelerating the active case finding missions. We're really trying hard on that to root out all the cases that are hidden in Samut Sakhon or in other provinces around the country. So this aims to break the chain of transmission as soon as possible. And I'll have a map of Thailand coming up to you shortly as a visual presentation, which was also shown by Dr. Tuisin. So for the overall situation in the country, you see the map here. It's becoming more greener, so to speak. So the green provinces are actually those who have not been finding any cases for the past 7 days. So that's a bit of good news. It's more concentrated on particular areas and particular provinces, not as widespread as the beginning of this new wave. So more of green provinces now. This map, the legend in specifically would be those who have not found any cases for the past 7 days, and the yellow in the past 5 to 6 days, and orange in the past 3 or 4 days. But nevertheless, we have more green-colored provinces in this regard. So countrywide situation more positive, continuous decline in number of provinces per week per week. No new cases have been reported in 46 provinces in the past 7 days. So the green provinces are numbered at 46. Yeah, excuse me. So, however, we must remain vigilant still, especially in the current high-risk areas in Bangkok metropolitan region and in Samut Sakhon and nearby provinces. In these areas, the government will continue to step up control measures and business establishments, especially where workers have traveled across provinces. The CCSA continues to strictly require high-risk individuals who have been in close contact with confirmed cases to self-quarantine for 14 days. And if you recall, the 3 circles that we showed you yesterday, and the spokesperson showed you yesterday, the red, the green, and the yellow circles. So I'm talking now about the red circle, which is the high-risk individuals. And for other areas, lower risk, relevant authorities will continue to closely monitor business operations and implement active monitoring as a whole. Now, just for some other issues, we have also, in addition, one observation that particularly for this new wave, which began in December, the average age of patients, of those infected, is 34 years old. So actually working level. The professional level, professional people. And the youngest average is 3 months. The eldest is 95 years old. The ratio between male and female is at 1 to 1.36. So actually a little bit more of females being infected in Thailand. In terms of the maximum controlled areas, just a piece of information for you here, that we've seen several cases in the country which are linked to parties, actually, by individuals or groups, which could lead to becoming super spreaders. So it's very important that the provinces, that if you live in provinces that are in maximum controlled areas, there's a list of provinces up there in this infographic courtesy of the Public Relations Department. So if you live in these provinces, the Health Ministry has encouraged the public there to avoid holding parties or any celebrations or activities, especially in these provinces. It's very important to prevent another party to become another super spreader in Thailand. So that is from courtesy of the Public Relations Department and information from the Public Health Ministry. Yesterday I mentioned about the work of the partnerships that we have, the International Organization for Migration, IOM. I'll reiterate that again. And on the IOM, we have a infographic up there, yes. So IOM has launched this new interactive platform called MOVE, M-O-V-E, to help people, especially migrant workers in particular, to learn more information about COVID. So once again, here's the QR code for those who are interested in this information. Another cluster of information is, I'll talk a little bit about vaccines. Again, there are significant updates on vaccines in Thailand, in that the Food and Drug Administration has revealed that they have licensed the use of COVID vaccine from AstraZeneca on the 21st of January, 2021. The first 50,000 doses of the vaccine will be delivered to Thailand in February 2021. After vaccines arrive in Thailand, the Department of Medical Sciences will randomly inspect them to ensure that their quality is in accordance with the quality levels specified by the company, be it the first company that's arriving or the second or third tranches from AstraZeneca, to ensure that the quality levels specified by the company are in place before using them, rolling out them, and injecting them, inoculating them to the general public, to the public. An additional 150,000 doses is also expected to be delivered from March to April and down to the remaining months. Just once again, priority groups, 4 priority groups in the first phase of vaccinations for Thailand, and we'll have an infographic up there for you, a visual. Yes. The first group, of course, medical staff. Second, elderly, age 60 or more. Third, people with chronic diseases at risk, prone to serious COVID symptoms. Fourth, quarantine officials. And of course, these are the main priority groups that we have set. And we'll be perhaps looking at the context and the situation when the time comes, when the vaccine actually arrives. As mentioned, the CCSA is now considering further relaxation of measures as appropriate in appropriate sectors, in appropriate areas, schools perhaps, restaurants, business operating times, and things like that. But of course, not across the board. I like to reiterate, it's not across the board. It's according to the each context, each industry, and the effectiveness of the measures and how much these measures are being abided by in each sector. So this follows, of course, the easing of restrictions of 13 activities already eased in Bangkok last Friday, as well as other provinces due to the decreasing cases of local transmission. And these other provinces are like Phuket, Ayutthaya, and Nakhon Ratchasima, which I had outlined earlier in the earlier days briefing. So just to end today with the word caring society. That's still very important. This is a project that's launched by the Ministry of Social Development and Human Security of Thailand. Caring society. So amidst the COVID pandemic, the spirit of sharing and caring for one another is still everywhere in Thai society. So the Ministry of Social Development has announced this project, this plan to send grocery vans to the 25 highly controlled provinces, red zone provinces, where the local communities find it difficult to travel to places to get groceries. And the vans will provide necessary consumer goods, as well as face masks and alcohol sanitizers, to the low-income families affected by the spread of COVID. Yes, and you have an infographic there. The Social Development Ministry will also be open to receive complaints and comments from various communities around the country to accelerate the assistance to them based on their feedback. The first 15 grocery vans in this project will be sent to 5 priority provinces, namely Nonthaburi, Pathum Thani, Samut Sakhon, Samut Prakan, and Bangkok starting tomorrow, the 27th of January 2021. So just by ending, I'd just like to end by saying that we are looking forward. Thailand is looking forward to stimulate the economy, stimulate recovery, looking ahead in the point that when we reach the post-COVID time, we will be able to live life normally. So in stimulating the economy and stimulating recovery, it's important that we plan out our efforts. So at the forefront of our economic revival recovery would include the idea of bio-circular green. Bio-circular green. So that's BCG in short. So we will give importance to the BCG policy in the forefront of our outlook and what we will be doing to help revive the economy. And the plan has been set up for the year 2021, this year, until 2026 for this 5-year plan for BCG. It also includes issues about food security, about medical and wellness, about bioenergy, about everything bio, everything circular, and everything green, and of course about tourism as well, green tourism. So BCG will form part, actually be the core of our policy in revival in the years and the months and years ahead. And I'll perhaps be providing more information about this concept of ours, which will be translated into policy and into action and into projects on the ground, and for the benefit of Thai society, people living in Thailand, and those who call Thailand home. So thank you very much for your attention. This is all I have for today. and we'll see you again tomorrow. Please stay safe. Thank you. สวัสดีครับ
ขอขอบพระคุณนะครับท่านรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศท่านณัฐพานุนพคุณครับคุณผู้ชมครับรายการในช่วงบ่าย 14 นาฬิกาจะเป็นรายละเอียดเกี่ยวกับรถเครื่องวิเคราะห์ผลด่วนพิเศษนะครับของทางกรมควบคุมโรคท่านที่สนใจอยากจะติดตามรายละเอียดที่เกิดขึ้นว่ารถคันนี้สร้างประโยชน์ในแง่ใดบ้างติดตามในรายการ NBT รวมใจสู้ภัยโควิด -19 ทาง NBT 2 HD เวลา 14 นาฬิกาและนี่คือทั้งหมดของการแถลงข่าวนะครับคุณผู้ชมติดตามการแถลงได้ทุกวันเวลา 11 นาฬิกา 30 นาทีวันนี้ผมธีวัชชูรัตน์พร้อมทีมงานทุกคนต้องขอลาไปก่อนสวัสดีครับ